Run for grace through every mile. Scream for life with every smile. Together we stand, strong and true. Run for grace, we'll see it through. Run, 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 run. Run for grace through every mile. In the morning light, we lace up our shoes, running with hope in a world we choose. For every heartbeat, for every life, we run for grace and scream for life. Run, 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 run. Run for grace through every mile. Scream for life with every smile. Together we stand, strong and true. Run for grace, we'll see it through. With every step, we break the chains, lighting the path through joy and pain. For those we love, for those we have lost, we run for grace and scream for life. Run, 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 run. Run for grace through every mile. Scream for life with every smile. Together we stand. Run, 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 run. Run for grace through every mile. Run, 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 run. Run for grace through every mile. Run, 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 run. Run for grace through every mile.
Hi, good evening, everybody. This is Dr. Venkat here. Wow, after that awesome introduction to the Global Grace Cancer Run scheduled to be on Sunday, 12th October 2025, we now have an awesome session and we have Dr. G. Vamshi Krishna Reddy with us, who has over 15 years of experience in medical oncology, and he's the director of oncology services and consultant medical oncologist and hemato-oncologist at Yashoda Hospitals. And he has done his DM in medical oncology from the prestigious Nizam's Institute of Medical Sciences. And he's experienced in treating various cancers with chemotherapy, targeted therapy, and immunotherapy. And is involved in the management of cancer patients from diagnosis to treatment and planning. And his educational qualifications are one of the best, and he is one of the topmost medical oncologists of the state. And today's topic is an interesting topic. It's about the gynecological cancers and its prevention, and also how to take care and with the lifestyle modifications. And it's going to be more of an interactive session with questioning and answering. So I welcome Dr. GVK sir, and it's all yours, sir.
Thanks, Dr. Venkat. It's a great privilege to be in this interactive session where we'll be discussing about the gynecologic cancers. To start with, I think gynecologic cancers are not a rarity. So all of us know that breast and cervical cancers are the commonest cancers which we see in women. And not far is the ovarian cancer, which we are seeing quite often in younger women nowadays. So these are the three cancers which are really bothering us for the various preventive modalities which we'll be discussing, and also the treatment things. And the other cancer which probably is again catching up with other gynecological cancers is the endometrial cancer. So earlier we were seeing endometrial cancer in women postmenopausal age, like around 50 or 60. But have good number of patients in the last couple of years. We are seeing in their 30s presenting with endometrial cancer, which itself is quite frightening because when to suspect a cancer in women is now a big dilemma because the age-old teaching, which was when we were trained, was that cancer usually happens in the elderly, other than the cervical cancer. Most of the times, the ovarian cancer and the endometrial cancers were a disease of elderly, but that dictum is not relevant in the present day. So we are seeing endometrial cancers as young as 31, 32. I have patients who presented post-delivery with endometrial cancers and the cervical cancer. Uh, Good thing about the cervical cancer is we have a lot of preventive strategies available. So with that, we are seeing the incidence of cervical cancer dropping a bit. And the other cancer is the ovarian cancer, where we have a lot of researches and advances going into it. So with this brief prelude, I think we're good to take questions and let us keep it as an interactive session. So I'm unable to see any questions. Dr. Venkat, where do I
Yes,
get the
sir.
question?
So I will be asking you questions, sir, as we get
Okay.
it from few of our viewers.
Okay.
So what are the common types of gynecological cancers?
Yeah. So keeping the breast cancer aside, uh, though it's a part of the gynecology team where we'll be seeing this. So when we're talking about the specific gynecologic cancers, we have cervical cancer, next is ovarian cancer, and the third is endometrial cancer. So these are the three common gynecological cancers which we see in our day-to-day clinical practice. And we have rare gynecological cancers like the germ cell tumors, the teratomas, and also the sex cord stromal tumors. These are part of the ovarian cancers which are not that common. So we'll be talking mainly about these three cancers: the cervical cancer, the endometrial cancer, and the ovarian cancer.
What are the early warning signs and symptoms to watch for, and how can women reduce their risk of developing cancers, especially gynecological cancers?
Yeah, so I think we'll discuss about each cancer per se. So first is about the cervical cancer. So cervical cancer is known to be caused by a virus. So it's caused by a HPV virus. So whenever a woman gets infected with this HPV virus, over a period of time, the normal cervical layer changes to abnormal cells and later into the cervical cancer. So there is a very good long interval from the time of viral HPV infection to the development of cancer. So we have to catch in this window. So today I had two patients who came to me with HPV infection. One was 18 positive, which is a high risk strain. So other lady also was HPV positive. So this is a common clinical scenario which we see. So why are we testing for this HPV in this woman? So as I said, because this is a disease which most of the times is caused by this HPV infection, we have availability of tests to detect this HPV virus. We call it as a pap smear test, which is usually now more advanced with the liquid-based cytology and has the addendum of HPV DNA testing. So earlier there was only a pap smear testing. Now I think with the advancements we have the even the HPV DNA testing. So we usually suggest this test for all women in the reproductive age group who have initiated the sexual activity, and it has to be done based on whether we're adding the HPV DNA testing or not. So we just take a smear, test it, and if it is positive, we usually go for more aggressive screening with colposcopy for this woman. So cervical cancer is caused by HPV virus. We have very good test to detect them early, which is the pap smear and HPV DNA cytology. What are the symptoms of cervical cancer? Most of the times, it's a very vague symptom. Women do present with white discharge, or they also present with bleeding on and off, or postcoital bleeding. These are the common symptoms for which women do present to the gynecologist most of the times for evaluation of the symptoms. So once the gynecologist does internal examination, they'll be able to identify what type of cancer is this. And the next cancer which we'll be discussing is the ovary cancer. So ovary cancer, unfortunately, most of the times is diagnosed most of the times in advanced stage. The reason being abdomen is a very huge space. Ovary cancer has a lot of time to grow and spread throughout the abdomen, and to cause symptoms, it takes times. The commonest symptoms of ovarian cancer are abdomen distension, like feeling of loss of appetite, if you have pain abdomen based on the implants. So ovary cancer, unfortunately, there is no screening test for ovarian cancer unless we have some patients who are diagnosed with this BRCA syndrome, where we see higher incidence of ovarian cancer. So this BRCA syndrome patients are not everyone, so we don't usually suggest screening for ovarian cancer. And the last cancer which I'll be discussing is endometrial cancer. Endometrial cancer again is most of the times diagnosed very early compared to the ovarian cancer, because they is present with postmenopausal bleeding. Most of the times it is evaluated very early because they present with bleeding, and it's usually evaluated by the gynecologist, and most of the times with a simple ultrasound we'll know once we do the DNC or biopsy to diagnose this endometrial cancer. So these are the three cancers which we commonly see in women, and fortunately easily identifiable with symptoms. Other than the ovarian cancer, the cervical and endometrium are very easy to pick up. So we have good tests to diagnose and also very good treatment for them.
So can you throw some light on HPV vaccination, and also the best vaccine available in the market, and also the age groups and different data on HPV vaccination?
Yeah. So I think we'll start with the cervical cancer prevention. So we have two modalities of preventing cervical cancer. So one is with vaccination. So vaccination is giving the killed vaccine to either men or women. So more relevant is what we're talking about, the gynecological cancers, where we'll be giving this HPV vaccination. So we have two types of vaccines available with us. So I'll be talking about the best, so will not confuse you. So Gardasil, we have the 9-valent Gardasil vaccine, which is very much available with most of the doctors. I think most of the times the pediatricians, gynecologists, and even the oncologists have started to give. So the patients need to be vaccinated anytime from 9 years onwards, but the typical age which we are administering or suggesting is 11 to 26 years, and it depends on which age we are starting the dose. So if the patient is given the vaccination before 15 years of age, just 2 doses are enough. But if we are starting the vaccination post 15 years, we need to give 3 doses. It is at 0, 1, and 6 months. So once we give today, we give 1 month later, and again after 6 months. So this is the commonest vaccination. Gardasil is given as a simple IM injection which we give, and the Gardasil 9 is the brand which is available with us. So how does it help? So we are giving this vaccine before woman catches infection. So most of the times, the HPV vaccination prevents the viral infection just as we do for the flu vaccines or other vaccines. So we need to give it before the person acquires this infection. So we give this as a 3 dose series for women above 15 years of age. In younger girls, 2 doses are enough. And side effects wise, I think pretty much safe vaccine. Other than the injection site pain, we do not see much side effects. And what is the benefit of it? Yeah, this vaccine prevents cancers caused by the commonest strains which causes cervical cancer. So that's the benefit of taking this vaccine. So if someone asks me, is there anything which you like to do for young kids who are at least going to be prevented with the cancer? I think as we are giving vaccination for all kids with hepatitis B, BCG, everything. So we also give vaccination for HPV vaccine, mainly to prevent the cervical cancer.
I think in this aspect, Grace Cancer Foundation is doing a great job by going to all the schools where underprivileged children and all the government schools, and it has vaccinated thousands of girls for the HPV vaccine. I think dose 1 and dose 2 have been given in most of the places, and it's doing a commendable job. Just brings to thing that almost thousands of girls have been vaccinated by Grace Cancer Foundation at free of cost. That's a great job. And sir, coming to the next question, can you talk briefly about vaginal and vulvar cancers and how common are they? And will HPV vaccination prevent these cancers?
Yeah. So the other set which we are talking about is bit uncommon. We don't see vaginal vulvar cancers that commonly compared to the other cancers. Second thing is about the cause. Yeah, again, most of the times the vaginal cancers again have the same etiology, the vulvar cancers also, but they do have other cancers other strains which can cause this. So not that common cancers, and most of the times they are treated in a similar way as cervical cancer, and the vaccination, yes, does help in preventing few of the vaginal and vulvar cancers.
Sir, what take-home message do you want to give to the younger generation for lifestyle modifications and also to all the cancer survivors out there to prevent recurrences and also to take care and come to the hospital instead of Googling and come to meet the right doctor?
Yes, so I think that's a great question actually. What message? I think before I give a message, I just want to tell in brief about what exactly is happening and what is causing all this increased incidence of these cancers. So for the cervical cancer, I'll not talk much because I think a lot of work is being done by Grace Foundation, and I think a lot of social organizations are coming up with preventive strategies. And because of the widespread availability of this Gardasil vaccine, we have, I think it's part of the immunization program for most of the women. So please do go for the HPV vaccination. And even though the vaccination has been done, it's not an excuse. So still you have to go through the pap smear screening test. So vaccination is one part. Second, pap smear. Both of them have to be done. And by following these two strategies, I think vaccination, as I said, take the vaccine for 2 doses if you're less than 15. If they're more than 15, take those 3 doses. And then once the initiation of sexual activity, we can go ahead with the pap smears based on the LBC. If you are doing with the HPV DNA, we can do once in 5 years. So it's not that frequent visits which we'll be doing to the gynecologist. So try to see that you go for the vaccination and the pap smear testing with HPV DNA, which is the most advanced testing available with most of us. And is there any lifestyle changes for HPV and cervical cancer? I usually don't suggest. I think if you're following up these two, I think that should be good enough. And next is the ovarian and endometrial cancers. Okay, these are different set of cancers. So endometrial cancer, as we were discussing, I think it does have a lot of relationship to the diet, the exposure to external estrogens, I think with a lot of contamination which we are seeing in our food. I think that's probably one of the cause causing early puberty, and I think the same reasons are probably extrapolated to the endometrial cancer also. So how to prevent it? I think avoiding the external bad food, as what we call. I think what is exactly bad is a big question. So we usually suggest diet which is rich in plant-based diet, that is more of fruits and vegetables, and avoiding the meat, fats, fried food. And also because I think most of the times the present food, the eggs and everything is laced with some hormones. So that's where I think we are picking up more of these cancers. So try to stay away from those. So more of plant-based diet, and second is being in an appropriate body weight. So not being obese or overweight with good physical activity will prevent the endometrial cancers. And regarding the ovarian cancers, I think if there is a family history of ovarian cancers, please do go for the genetic testing. And if any of them has the high risk genes, they will have a separate screening program. And most of the times it's ultrasound abdomen. And we also do few markers like CA-125 and calculate the risk of malignancy for these patients. So that's about these three cancers. So gynecological cancers, fortunately are treatable and preventable too.
Well, thank you so much, sir. That was an awesome session. And we'll just wait for a couple of minutes. If there are no questions, then I think I will close the session.
Yeah.
Yeah, there is one question, sir. It is from a regular viewer. She's asking if the gynecological cancers will also have genetic predisposition, and like breast cancers, is, say if her mom has a CA endometrium, will she also have some kind of a gynecological cancer?
Yes, I think we have already tried to discuss on this. So if we are talking about the endometrial and ovarian cancers, both of them have a hereditary or genetic component too. So if there is a first degree relative affected with ovary cancer or endometrial cancer, most of the times we need to test the index case. That is the person who is affected first. We try to see if they have any of this high risk hereditary cancer gene. So if they have this gene, we usually test their family members, that is their siblings and their children for this gene. So if they have this, we put them on the high risk screening. So definitely, I think for endometrial and ovarian cancer, we do suggest genetic testing. Hereditary cancer panel is a test which we usually suggest for the index patient. And cervical cancer, we don't do any genetic testing. It's just a simple HPV virus and pap smear.
Well, thank you, sir. That was a great informative session on gynecological cancers, how to prevent them, and also how to and when to come to the hospital and the doctor to get checked, screened, and treated. And I think our viewers will be well educated now with this brief session about the common issues and how to prevent them. So with no questions coming in with this, I will close the session, sir, with your permission. And uh, reminding everybody to please participate in the Grace Cancer Foundation run, which is on October 12th. It is a Sunday. And it also gives you a brief insight into how many conquerors, the cancer conquerors, are coming to participate into the run. It is going to be a huge event in Gachibowli Stadium. And it will also give us a chance to get into the active lifestyle. Thank you very much, GVK sir. And thank you, viewers, and thank you, everybody.
Yeah, thank you, Dr. Venkat and team. Thanks. Good luck. Bye.
Thank you, sir. Bye. Usha garu, Karna garu.
Yes, sir.
So yeah, done. He wanted me to keep it very short and sweet. So I winded it up because he had some other thing also. Anyway, bye-bye.